effective healthcare, methods that we know are effective, in a way that will respect their beliefs and autonomy and not drive them away completely. There's actually a whole lot of literature about medical adherence and religiousness and religiosity. Ignoring it can lead to worse medication adherence rates for HIV and hypertension. And actually there's an article that I have in the bibliography about heart therapy in pediatric patients and how spirituality seems to correlate with increased compliance. And actually there's probably about a dozen articles in the last couple of years about that topic specifically. Let's see, there was one other thing I wanted to bring up. Anyway, moving on. So there's a load of articles across the literature encouraging physicians to incorporate a patient's spirituality into their assessment and treatment plan. There's studies showing why this should be so. There's also recommendations by the major organizations. So I have a couple here. The first is by the American Academy of Pediatrics. This actually is coming out in their September Pediatrics in Review journal for this month. The next comes from the American College of Physicians. Physicians should screen for unaddressed spiritual and existential concerns. In addition to addressing physical suffering, patients can extend their caring by acknowledging and exploring psychosocial, existential, and spiritual suffering. As patients struggle to find closure in their lives, active listening and empathy have therapeutic value in and of themselves. So that's the official position of the American College of Physicians. The American College of Surgeons deals with it in the context of palliative care. Physicians should recognize, assess, and address psychological, social, and spiritual problems. The American Association of Medical Colleges states that physicians must seek to understand patients' stories in the context of patients' beliefs, family, and cultural values. So that's about engaging patients on spirituality. So I've said this before when I've spoken here. This is actually going to turn into a lecture also that I'm going to do for the house staff when I'm on the inpatient unit. It'll be a good way for me to ask the house staff to at least ask a spiritual screening question at every patient encounter that they do, every admit. And I think this is a good starting place to sort of give you a sense of the literature about why we should engage patients spiritually, and the fact that it is supported throughout the literature and supported out through fairly major medical organizations. But generally speaking, there's actually quite a few studies, and the response rate is never zero. It can be very low, in all fairness to the literature. It can be as low as 5% of people would want to engage their physicians. Now that tends to be in studies where the question posed in the research is, do you want your doctor to talk to you about religion? Okay, so completely removed from a healthcare context. And those questions tended to get very low response rates. Once you contextualize the question, would you want your physician to inquire about health beliefs if they were to affect your health care? The response rates go through the roof. Once you contextualize it even further, if you were gravely ill, if you were in a death and dying scenario, if you were hospitalized, again, the response rates go up. Okay? So the literature, the bias, I suppose, in the literature is that these things tend to be studied in places where there's going to get some positive response. A lot of the studies are done in the South, where there's already a high church attendance rate. They tend to be done in areas where a high percentage of the patients already identify themselves as Christian. So for example, if you go into a community where most of the patients don't identify themselves with any religion, and maybe there's some hostility in the community to religion in general, and you try to replicate these studies, you'll probably get lower response rates. Okay, so that's some of the caveats of the studies. But the studies are done in inpatient, outpatient, acute rehab. They're done with well patients. They're done with sick patients. So you do get a full range. So patients are religious. Patients want to engage their physicians on a spiritual level. Doing so also helps physicians understand the patient and separately helps the patient feel understood. There's a distinction. It's a small distinction, but it is there. And I put a couple scenarios. Sometimes because of religious beliefs, patients may refuse an effective therapy, such as a blood transfusion. I had one patient refuse Rogam during her pregnancy, which is if the blood type doesn't match the baby's blood type. Patients can also demand fetal treatments because of religious beliefs, such as cardiac resuscitation, or demand the continuation of a fetal treatment because of religious beliefs. Sometimes patients, because of religious beliefs, can refuse to believe a diagnosis or an outcome. You know, I prayed about this, my cancer is cured, I prayed about this, I believe in faith healing, I don't have HIV anymore, that type of thing. Okay? So those are some examples that I came up with. Again, there are studies to this effect, although not a lot. The studies have to do with sort of patients self-reporting that they would feel better if the patients understood that from a religious perspective, and then case studies where there's examples of people where there's conflict with the healthcare team, and then there's a religious issue that allows that conflict to be bridged. Again, an Amen study from Presbyterian Hospital, they said that patients said that taking a spiritual history would increase trust with their physicians. There's a lot of commentary. If you look at the references, one thing I really enjoyed is just seeing how mainstream this topic is. The first guy, Dr. Lowe, who writes a lot on religion and spirituality at end of life. His first article, the first reference here is from JAMA. There's one on chest, which is interesting. Chest is a pulmonary journal. And statements like this are really common. Clinicians have a moral obligation to attend to their patients' spiritual needs. First, the physicians and other healthcare professionals have sworn to treat patients to the best of their ability and judgment, and the best care treats patients as whole persons than to treat patients in a way that ignores the fundamental meaning that the patient sees in suffering, healing, life, and death, is to treat the patient superficially and fall short of best ability and judgment. In the Lancet, again, this is Dr. Sloan, who is the guy from Columbia. He's all over the literature, by the way. He writes a lot of letters in response to articles supporting engaging patients on spiritual beliefs. But even he writes, a thorough understanding of a patient's religious values can be extremely important in discussing critical medical issues, such as care at the end of life. Irrespective of the practitioner's religion, respectful attention must be paid to the impact of religion on the patient's decisions about health care. So in addition to patients being spiritual and religious, patients wanting to engage their physicians on a spiritual level, for the purpose of understanding, patients make medical decisions based on religious beliefs. Again, from Amen's study and another the study from Dr. McCord, they found that almost half of patients make medical decisions based on their religion. And if you're trying to change a patient's behavior, trying to understand why there's a conflict between what you're recommending and what the patient's carrying out, it's possible that that gap will never be bridged without discussing spirituality. Patients incorporate spirituality into how they cope with an illness. So this is a coping skill. I'm sort of getting into a little bit about efficacy, but without any question. So once you have kids, you'll be able to ignore all this. Patients incorporate spirituality how they cope with illness. When you get surveys, here's one from the Journal of Religion and Health. I think this study was done at Mayo Clinic. Actually, I can't remember off the top of my head. But 85% of women with breast cancer said that religion helped them cope with an illness. If you're trying to bring comfort to a patient, and you don't realize that religion and spirituality is how they mainly achieve comfort, and you're trying to give them other things to help them achieve comfort, you're going to miss the boat. Especially in a hospital setting where most of you guys are going to be doing just a boatload of rotations. You give somebody bad news, you give them a new diagnosis or a poor prognosis. If you don't ever bring up spirituality, you may miss out on really giving them their own best self-selected tool for comfort. Okay. In a study with melanoma, patients who were religious were more likely to use active coping skills that were healthier, as opposed to just sort of sitting around and passive coping skills like denial. This next article about spiritual well-being at the end of life, actually, this morning and last night, I found that there's like 1 million articles on this. Spiritual well-being is the strongest predictor of quality of life measures in almost every palliative care study that measures it. There are dozens of articles on this topic alone, and they tend to be fairly recent. So one conclusion, again, there's a lot of articles supporting this, and here's one from Annals of Internal Medicine. It says the support of hope should fall within the purview of the physician. This is from an article on spirituality. In other words, if a patient uses spirituality as a coping skill to help them deal with an illness, a loss, a disease, a poor prognosis, it's well within the ethics, medical ethics, to support that and allow them to have healing. There are articles about neglecting spirituality, and that's the next section here. It's interesting, these next couple articles are from inpatient rehab. It basically said that a lot of times patients are neglected, they have spiritual needs, and unless somebody does a screening tool, nobody's going to notice. And a lot of missed opportunities for chaplaincy. Yeah.
Anyone here ever heard of the Trinity Broadcasting Network?
Yes.
Good. It works for me. $720 a month, prayers are answered.
Actually, because, anyways, actually just filmed a thing for them.
Yeah.
I didn't do very well because I found out that speaking into a camera for 8 minutes is actually really hard. But I tried. I'm going to go back in October. But right. So patients, that's a good point. This actually, I don't bring that up here, but patients are already incorporating a lot of spiritual tools. They're engaging in health in their churches, health in their homes, and reading books on health and spirituality. I mean, it is a paradigm by which a lot of people approach their health, and it's a very good paradigm for how people can approach their health. It starts getting a little bit into efficacy stuff, talking about weight loss clinics in churches versus weight loss clinics, through Jenny Craig. But there are, without any question, patients definitely use religion. There are studies looking at all the different ways in which patients already use religion in their health behaviors. One of the interesting articles from the Journal of Pediatrics is that ignoring a patient's beliefs can drive them away from medical care to their detriment. They actually looked at 172 children whose parents relied on faith healing who died. The majority of them would have lived if there was some way to bridge that gap between the patient's parents' belief on faith healing and medical care. So in other words, if the physician just blew them off and said, you know what, faith healing is just a load of phooey, it means nothing, you're an idiot for believing in faith healing, and it drives the patient away from traditional health care, it can actually lead to harm. So ideally, there would be some way for a savvy healthcare provider to incorporate a patient's beliefs into traditional. Now, what this research study did not do is ask if people would be offended. So the people who said that they would not want to be asked whether or not they would be offended by being asked or why they didn't want to be asked. Because the answer to the question, so the question that was studied was, would you want your physician to ask you about any religious beliefs if you were gravely ill that might affect your health care, I think it was. Because they could just answer no and move on. So it's not clear if they were being offended or they were afraid of engaging in spiritual discussion, because that actually wasn't the question. So whether they misinterpreted the research statement. The research statement was seeing if they would want to be engaged, not actually engaging. So it's not clear from this study what sort of the result was of the negative outcomes.